Badon.
Let's talk health now. It's been 3 years into the administration of Governor Doue Diri of Bayelsa State, but the proposed health plan by the government is yet to be passed or implemented. This delay is causing lots of hardship for health workers and residents of Bayelsa State. In this report, TVC News Diri speaks with stakeholders in the health sector on why Bayelsa is still sitting at the lower rung of the COVID vaccination table.
The COVID-19 vaccines is not limited to Nigeria. It's rather a global phenomenon. Although this has been attributed to a number of factors, however, here in Nigeria, about 65 million eligible persons have completed their doses. In Bayelsa State, across the 8 local government areas, there are about 214 primary healthcare facilities. This time, that number is inconsequential because most of the facilities are moribund. For those that still exist, there is an acute shortage of equipment, medical and health personnel.
We cannot give a good score as far as our health facilities standard is going to be considered, although it's better than when I was younger.
The National Primary Healthcare Development Agency says Bayelsa, Rivers, Ondo, Kogi and Ebonyi sit at the bottom of the country's COVID-19 vaccination campaign ranking. But the state alludes to the fact that there are problems with vaccine distribution.
You can see the numbers growing in Bayelsa State. Thank God we are not behind again, and we are moving upward. And we know every day we go out, our teams in the house, as I'm talking to you, there are various communities giving the support to the flood victims and also giving immunization services for the COVID-19 to our people.
At the forefront of the vaccination campaigns are overworked and underpaid health workers. In Yanagwa, the Bayelsa state capital, Biobolo, a community with a population of about 42,000, is jostling to get affordable health care in Yenezwe-Gene Primary Health Center, a health center in dire need of trained workers, electricity, water, and wash facilities.
Since there are no disbursements, the fund to buy those drugs are not there. So they are on stand waiting. So if they come in for the capitation, we subsidize and give them the drugs, sometimes free. But these drugs are not many.
The officer in charge claims they got allocation from the Basic Health Care Provision Fund once in 2022, and that's in the second quarter. From that time till this minute, they're yet to get allocation to maintain the primary health facility. Sarah Ayeku, TVC News, Yanagwa.